Hello, and welcome to the ethical use of art therapy techniques for clinicians, mental health providers who are not specifically trained and licensed to practice art therapy. My name is Jennifer Kramer. I'm a licensed professional art therapist in the state of Kentucky, and I'm so excited to bring this training for you today. I get so passionate and excited about sharing the basics of the art therapy techniques that I have learned in my schooling and in my practice over the years with my clients and with my colleagues, so that you can practice it either personally or professionally on your own to a certain extent. And the reason why I'm framing this as an ethical conversation is that there are a lot of ethical issues that come up here as far as, is it even professional for me to be sharing these techniques with you when you don't have the licensure to practice art therapy? So we're going to get into all of that. But I'm sure, spoiler alert, you can tell I am going to share some things with you today. I do think there are some practical tools I can give you that you can implement right away in your practice, or like I said, personally in your own mental health care for yourself. So we're going to get right into it today. Well, actually, first I'll go ahead and share just a little bit about what I do. I have a lot of experience working with children in art therapy in the school system and in other agency settings, in home therapy. And now I have transitioned over the past couple of years to working with women who are survivors of narcissistic abuse. I also have an online coaching program. So I'm kind of straddling the line between doing art therapy and also coaching. So again, some ethical issues there, but I love thinking about these problems and how to solve them so we can get these really beneficial, really just fun art therapy techniques out there to others in an ethical way. And I could share more about that at the end if you'd like, about the work I do, and share my contact information. So first, what is art therapy? So I'm gonna read for you this excerpt of this definition from the American Art Therapy Association. If you would like, you can go to their website. They have the full definition. It is very long. But this part of it, I think, is the most important that I want to highlight today. It says art therapy is an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, the creative process, applied psychological theory, and human experience, all within a psychotherapeutic relationship. The biggest thing I want to highlight here, well, two things. One is that art therapy is for all ages. It is a human services profession for everyone, for individuals, families, groups, communities of all ages. So this can look like community art projects out in your city, community murals where multiple people participate. This could be a family art therapy session. It could be a one-on-one session with a young child, with a teen, with an adult, with the geriatric population. It is widely accessible and available for everyone. Those with physical disabilities, even clients who are vision impaired. There are techniques to use where the art therapy can still be helpful for them. So it is appropriate for everyone, for all ages. And then the second thing I want to highlight is it takes place within a psychotherapeutic relationship. So many of us are familiar with the adult coloring books. And when those first started coming out, I know a lot of those they actually said art therapy on the title, and art therapists across the globe were so up in arms, so upset about that, because coloring in a coloring book is not art therapy. Just like working through a DBT, workbook on your own, or using some cognitive behavioral therapy techniques to challenge your limiting beliefs by yourself is not doing cognitive behavioral therapy, right? You can't do therapy to yourself. It takes place in that therapeutic relationship with the trained and licensed professional. Excuse me. So with art therapy, it is the same thing. And we're going to get into more of the distinction between that. There is what we would call art as therapy, which is just engaging in the art process, the creative process of visual art that is inherently therapeutic. And then there is art therapy. Okay. Again, this takes place within that relationship with a trained and licensed professional. So I'm just going to give an overview for you here so you understand what's involved in getting art therapy credentials. This wording is specific to the state of Kentucky. I know sometimes art therapists are called creative art therapists. There's some other names in other states. But first of all, an art therapist is trained at a master's level. They have a master's degree in art therapy, or my degree is from the University of Louisville, and it is in counseling with an emphasis in art therapy. And so my degree qualified me to both pursue licensure in counseling and in the LPCC, and then also the LPAT, the art therapy license. So the credentials that are recognized in the state of Kentucky, and again, this differs. There is not art therapy licensure in every state. In Kentucky, this happened, I want to say 2009. I was in graduate school, and it was so exciting to be, just entering the field and have this approved. So similar to the counseling license on the associate level, the LPCA, and then you work up to the LPCC. That's what we have here in Kentucky with the art therapy license. So there is the LPATA, which is the Licensed Professional Art Therapist Associate, and then there is the Licensed Professional Art Therapist. So to have your associate degree in art therapy here in our state, you have to have a supervisor sign the supervisory contract. You have a certain number of hours of supervision you must meet, and a certain number of client contact hours. Then there is also a test to take, which qualifies you to become a board certified art therapist. And this is where it gets a little more complicated. I'm just giving a brief overview. If you're interested in this, you can go to the Art Therapy Credential Board, the ACTBE website, Art Therapy Credential Board, or not ACTB. That is where the testing takes place through them. So if you head up an agency and you're looking to hire an art therapist and you're just curious about what qualifications there are, you can go to the Art Therapy Credential Board website. Also, just look up licensure in your state licensing boards. So the LPATA, no, here we go. The LPAT, you can't have it until you've taken the test, which is equivalent to the board certified registered art therapist. Okay, so first you earn your registered art therapist kind of simultaneously to your LPATA, but you have to work with two different licensing boards, the National Credential Board and your state licensing board, for those two different things. And then once you take the test, you're a board certified art therapist with the National Credential Board. And then you pay your fees, fill out your application to apply for the licensure in your state, the independent licensure. Again, if you all have any questions, you can email me if you need that. My purpose of sharing this for most of you all is just to understand kind of that a licensed art therapist who is practicing in your agency, in your city that you're looking to refer clients to. This is someone who is a licensed mental health professional on your level, just like any other mental health profession, any other designation within our field. So art therapy is not a theoretical approach. This is something that's really interesting, and I think a lot of clinicians are not aware of this. So I just wanted to point this out. So a lot of us think like, okay, well, I use reality therapy today, or CBT, or solution focus, and then I used art therapy the next day. But a better kind of way to understand what art therapy is that it's more of a series of techniques that can be applied to any theoretical approach. So later I'll share some examples of some artwork, some art therapy interventions that could be applied, that could fall under the category of different theoretical approaches. For example, I'll point out one that for sure has a very cognitive behavioral therapy element to it. So we have art therapy interventions that are more cognitive. We have ones that are more really like psychodynamic, where we're just really trying to just express ourselves and access kind of what's coming out of the subconscious, and everything in between. Any art therapy intervention you use, you could categorize in a theoretical approach. But art therapy is not a theoretical approach in and of itself. It's better thought of as a series of techniques. It is not using an adult coloring book. As I said before, there's a difference between the therapeutic process of art, just doing it on your own, and working with a licensed and trained art therapist. It's also not a personal hobby of art making for the same reason. That's something different. And again, we'll get into that more in just a minute. So with our ethical question that I mentioned at the beginning, is it even ethical for me to be doing this training? This is a quote, a question that Bruce Moon wrote in his book, The Ethical Issues of Art Therapy. I've got it right here. I'm going to show a photo of this cover here in a minute. So if you're interested in delving more into this, this is an excellent book. You know, I think it's so interesting. Bruce Moon is really sort of a father, a grandfather of art therapy. To my knowledge, he's still living. I don't know. I had the privilege of seeing him up on stage at the one National Art Therapy Conference I've attended. It was back when I was in graduate school. And he started out the opening, you know, keynote session of the conference by sitting on a stool on the stage, playing classical guitar, acoustic guitar for us. And I don't remember the song, but you know, it was this very like kumbaya type of moment. And those are just the amazing moments that we art therapists get to have at our conferences. I always say it's okay to be jealous that that's what we get to engage in at a professional conference. But at the same time, Bruce Moon wrote the ethics book, you know, of our profession, right? So it's so interesting, you know, a lot of art therapists balance their more artsy side with this very clinical kind of analytic professional side. So this question that Bruce Moon poses in this book is there any danger in providing art therapy techniques to colleagues from other therapy disciplines, so you, who have no special training in the use of art as therapy? And this is a big question, and it's kind of humorous to me. In kind of how with a lot of these ethical concerns, these big ethical questions, it feels almost impossible to give an exact answer, right? There's so many ways we could go with this, so many different rationales for either way of thinking. And so when I read this portion of this ethics book by Bruce Moon, I'm always reminded of this classic scene from the 1987 film, The Princess Bride. If you're familiar with the movie, this is the Battle of Wits. And we have our villain here, Vizzini, on the left, who has kidnapped the princess, and our hero, Wesley, has challenged Vizzini to a battle of the wits. He says in this tube he has here, there is some poison called iocane powder, and he says he's put it in one of the glasses, in one of the goblets here. And Vizzini has to guess which one does not have the poison and drink from it. And so we see the villain here go through this impossible kind of dilemma. He's thinking out loud. And this is what reminds me of Bruce Moon's conversation with himself, that, you know, surely I can't choose the glass in front of me because blah, blah, blah. And clearly I can't choose the glass in front of you because you wouldn't put it there. And iocane powder is from Australia, you know, blah, blah. He gives all these reasons. And it's obviously, we know in this funny monologue that he gives that he's putting off making a decision because it's an impossible choice, you know. There's no way to know for sure. He just needs to choose one and go with it. And then in the end, we find out while Vizzini is laughing maniacally, thinking that he has drank out of the correct glass, he falls over dead. And Wesley has poisoned both of the glasses, but he just developed an immunity to iocane powder. So he did not die when he drank from his glass. But my point in sharing this is to remember, even after this training, even after, you know, emailing me later to ask questions, if you're having a bit of a dilemma about this, about what feels appropriate and what isn't, use your best judgment, you know, from the best practices that you know, from what you've learned here, and make a decision. You know, I think with ethical choices, we're doing the best we can based on the information we have. Okay. So yeah, here's the book again. And so Bruce Moon, finally, after this conversation of it could go this way and that way, you know, he explains these three different modes of thinking when it comes to ethics. So there is the deontological legalistic approach, which says we should always follow the same rule no matter what the circumstance. We just need to stick to this law, this one rule of how to handle things. Then the opposite of the legalism is this antinomian approach that is total anarchy. It's the other end of the spectrum. Like every individual, you know, every mental health provider, every counselor should just do what they want to do. They shouldn't have to be bound to any one universal law or set of rules. And then, of course, in between, the more situational or utilitarian approach is this teleological mindset, where you just evaluate the situation on an individual basis and make the best decision you can. Here, the quote from him says, "The evaluation of conduct in relation to the ends that it serves." So you're thinking about your purpose, kind of what end you're hoping to serve with this choice, and then you're just going with the best choice given that situation. And so so clearly that's what I've chosen, is this teleological approach that is kind of a middle road. And so I believe firmly that you, as trained mental health professionals, are equipped to use some art therapy techniques in your practice. And I believe that it would be more of a detriment to your clients to not explore new and different techniques that you can use with them, right? Whereas others might argue that you're doing harm to your clients by trying to practice techniques that you're not fully trained in. But again, I trust in your training and your ability to employ these techniques, and I'm going to share with you here shortly, with the training you have and with the information that I'm going to provide. So like I mentioned earlier, so art therapy versus art as therapy. Again, art therapy is in a therapeutic relationship by a trained professional. Art as therapy is any kind of engagement in the creative process in visual art making that you find to be therapeutic, you or your clients. And so what I would say is what I'm sort of coaching and teaching you on today is how to practice art as therapy with your clients. Okay. So if you need to word this on a document, a professional document of saying kind of what you did, you used art therapy techniques. Okay. So you can use art therapy techniques and you're not doing art therapy because you're not an art therapist, but you can use art therapy techniques. You can say you engage the client in the creative process. You could say you used art as therapy. All right. I tend to say art therapy techniques, even in my documentation. That's what I'm doing. That's the intervention I used, was employing art therapy techniques. So these are some do's, and I'm share some don'ts as well. Just these are some really important tips. So this is a short slide, but these are really key to, like I said, the ethical practice of using these techniques with your clients. And these are things that a lot of people don't know, and that's why I want to make sure and highlight this for you. So do engage in your own practice of art making. So this is just really practical in a lot of ways, that, if you haven't used a crayon since you were in 5th grade and you're working with a client, either a child or adult, and asking them to use a crayon, you can't fully walk alongside them in that process and teach them in that moment and support them if you don't know what it's like to use a crayon. Okay. So at least with the very basic art materials that I'm going to suggest here in a few minutes, with the very basic art materials that I suggest you be equipped with in your office, if you're wanting to use these techniques, at least be familiar with those basic materials. Spend a few minutes once a week, once a month, just sort of checking in with yourself by doing some art yourself, doing some art as therapy, with your color pencils, your crayons, your markers. Just spend a minute doing that to refresh yourself. So it's not like you can do it today after you finish this training, color with some crayons, test everything out. Okay, I'm good. And then you never do it again. So you need to regularly engage in this process so you're familiar with what it feels like. I would even suggest the specific art therapy interventions that you're going to use with your clients. So again, later I've got some actual examples here that I've done that I'll share with you. Before you do it with a client, you need to have done that actual intervention. So it's kind of two things. It's getting used to the materials yourself, being familiar with how to handle the materials, because remember, well, actually, I guess I didn't say this at the beginning, but an art therapist has to have training in visual art as well. There are prerequisites for that master's level program that we have to have a lot of fine arts experience. My bachelor's degree is in fine arts, so I had that. And then we also have to have some psychology background, a handful of prerequisites in psychology, which I had to go back and get later. But we have to be coming from the foundation of both of those in order to even begin to study art therapy. And then in a master's level art therapy program, we practiced, we did all of the interventions that we were taught. We did it live in the class. I mean, our classroom looked like a combination between like a lecture room and an art room. There were art supplies in there. And we sat and did these interventions that I'm going to share with you later. In fact, many of the visuals I'm going to share are the actual ones I did back in graduate school that I've saved as examples. And so you need to be familiar with the materials, but also before you do anything with the client, you need to have done it yourself to really understand what that feels like. If you think back to your graduate school experience and your training and whatever specific kind of niche discipline you're in, marriage and family therapy, counseling, whatever it is, you likely had to practice those techniques, right? Like you're not just reading about the standard kind of questions and prompts in reality therapy without practicing it. So you likely had a partner, you might have videoed yourself, doing that with a classmate. So it's the same type of thing. You're not doing this in class like I was in art therapy school, but you need to actually practice and do this intervention yourself so you understand kind of how it works, what it feels like to do it. You may even get together with a colleague who's also done this training and kind of administer these interventions to each other. So do engage in your own practice of art making and practice the actual interventions. Do create art alongside your clients in the session if that makes them more comfortable. So you always want to do this based on what feels best to them. So if you know your client well, or you're just kind of good at reading them, you can sort of gauge that for yourself. If they feel a little uncomfortable approaching the artwork, then you can either just naturally kind of start doodling yourself, or you could offer that like, hey, would you be okay if I drew too? Or would you be more comfortable if I drew too? We all know our clients with kids, with teens, with adults, and depending on the personality, there's kind of a different way to ask those questions. But I would ask, and sometimes, I mean, clients will even say, like adults will be like, are you going to draw too? And I'll say, yeah, I can definitely do that. Or if I see that they might be uncomfortable, and this is really in particular with adults, sometimes they feel odd just sitting there doing artwork while I'm quiet. And we'll talk about being quiet in just a minute. And so I'll be quick to say that, and even kind of make a joke about it and say something like, I can draw too if you feel weird about me just like sitting here staring at you while you draw for 20 minutes. And they'll be like, oh yes, please. Or sometimes they'll just chuckle and say like, oh, it doesn't bother me, it's fine. But you wanna see what they're comfortable with, either just observing their nonverbals or just asking them directly if they'd be more comfortable with that. You wanna be careful, though, and this in particular with kids, but really with all ages, that they don't start focusing more on your drawing or painting or whatever than on their own work. And with kids, they'll often get self-conscious, depending on the kid. If they're a self-conscious kid, they might feel self-conscious about what you're doing, or they might try to copy what you're doing. So that doesn't mean you abruptly like put away your art and like, no, like don't look at mine. But you use that, of course, like you know what to do here. Like you use that as a part of the therapy in that session, right? Like you're curious about why they're so focused on your drawing. You ask them what they like about theirs. You praise them for that and how well they're following directions. But even with adults, I think adults can sometimes say, oh, look at yours, it's so great, and like mine is trash, but that's not what it's about. And so I even have those reactions sometimes from clients when I try to do the most rudimentary, scribble that I can, so it doesn't look awesome. But if a client is going to feel self-conscious about their art or about everything about themselves, then they're going to feel that way, So it's not because my art really was so great. That's just where they were. And you can use that as information and where to go in your session, what to talk about. But just be mindful of that as you're working alongside them. I feel like there was something else I was going to say about that. Maybe it'll come to me. So a don't here is don't continue to engage in talk therapy while the client is making art. Now, again, there's kind of a line here where you have to see what they're most comfortable with. So but I do want you to follow their lead. so sometimes they're not only uncomfortable with you watching, but they're uncomfortable with the silence. And as mental health professionals, we've learned, right? We've been trained to be comfortable with that silence. So we can ask an open-ended question and sit there in that uncomfortable silence, and we're okay with it. We know we need to allow that breathing room for the client to then share more, and that actually prompts more to come out of them when we leave that space. So it's the same with the art process. They need some of that space, and you could even say ahead of time, hey, we don't have to talk. In fact, I would recommend this to say, we can talk if that makes you feel comfortable. Again, just like with you drawing, if that makes you feel comfortable. But really, this is your time. This is your time to focus on this art, and I don't want to distract you from that. And I think, especially when I was a new art therapist, I often felt like, and also when I first started doing private practice and people were paying me out of pocket, I often felt like they paid me to sit here in silence for 30 minutes. And I felt kind of weird and guilty, like I hadn't done my job. And I want to bring that up because I think that's a natural tendency for us, especially if you're used to talk therapy. Sorry, I got some background noise here. You feel like you're not doing anything, but I want you to really honor the fact that art therapy intervention is the therapy. It is the therapy intervention in that moment. And there is so much going on internally for that client during those few minutes that they're drawing. It might not be 30 minutes, it doesn't have to be like half the time, but ideally it's going to be a decent chunk of time, and it might feel like a huge amount of silence to be quiet if they're not actively choosing to talk. But I want you to honor that time and know that is the therapy for them, and you're going to be there with them to verbally process that after. So that's something else I'll mention, is that I know I had this question when I presented this live of kind of how the session is usually structured. Typically, like I'll do sort of a check-in with the client to kind of see how things have been going since the last session. And then I will present whatever our art intervention is, whatever the art project is for that session. Sometimes it's open-ended, sometimes it's very directive, which again, I'll talk about that later. I'll share some more directive interventions with you. And then there's a time of verbal processing. So sometimes the client gets really into their work, and it is like 30 minutes or more of the session, depending on if you're working large or what you're doing, or just how they work. Some people are going to be real detailed and real slow, and you can get a lot of information about that from how they feel about themselves and anxiety. I'll talk about that later too, how that kind of comes out in the art process. But so then you need to gauge the time, of course, right? So you need to leave a few minutes at the end to be able to process it. Even if you're going to finish the artwork the next session, you're going to keep working on it. You do want to stop and have some time, some closure, some verbal processing about the experience after the fact. And I'm sure that makes sense to you. So if they do want to talk, then I would say, allow that if they're more comfortable with that. I even have one adult client who has articulated to me that it actually helps her to get kind of more in her subconscious and not be so analytical and like caught up in like what's coming out on the art, like when she's just able to kind of talk and vent about like what's happened during her week and everything while she creates the art. For some people, that would be too much of a distraction, right? They wouldn't really be able to get into their feelings and engage in the art process if they were talking about other stuff. But for her, that works. And so you might have to play around with this and test it out. If you see that they're just really distracted and not really putting focus into the art, nothing really significant seems to be happening there with the art, and they're talking the whole time, maybe suggest like, hey, I know it might feel uncomfortable, but I want to see, maybe even set a timer. I want to see if we can spend 2 minutes, 5 minutes, just in silence, and if it feels awkward, that's okay. We'll just roll with it and turn on some music in the background. Just let them know the importance of that art process, and you're going to give them the space to do that. Okay. I think most of us as counselors and therapists are okay with those little kind of confrontational moments, like just putting it out there, just be real about it. Like this might be a little weird, but I want to allow space for you to do this. So we're just going to not talk for a few minutes. So that's perfectly okay. Also, don't attempt to interpret your client's artwork. So this is a big one too. you probably won't be able to see these, but just as an example, there are books like this psychodiagnostics and personality assessment book. And this is Kinetic Family Drawing, specifically about one particular art therapy assessment that we can do. These are books to sort of score or assess assessments that you would give to a client. So there are art therapy assessments that, in a sense, you are interpreting what is there. Like this, an X showed up, and that could signify conflict, or how close, if you do a family drawing, the proximity of family members to each other, or is one drawn in some sort of box or circle encapsulated from everyone else, that can indicate some information about relationships. So as an art therapist, we are trained in some of that, but I would say primarily that's not what art therapy is. And a lot of people think that art therapy is about assessment and about the therapist finding meaning in the work. And that's really a misconception, I feel, especially nowadays. I mean, maybe in the past it was more like that, but really you always want to go with what the client says about the work. So you never want to just look at the work and say, oh, I could tell they were upset when they did that, and come up with all these conclusions. You certainly don't want to diagnose someone based off their artwork. Even as a licensed art therapist, I do not do that. That would be unethical. You want to pair kind of what you're seeing in the artwork with what they actually say. So one example is a common symbol that we see a lot is in a tree. If someone draws like a circle in the middle of the tree, that could be considered a trauma hole. And I, even with other art therapist friends, we joke about the trauma hole, and we can like get overly analytical about our own work. Like, I do a tree, but I want to make sure not draw the trauma hole, because that'll say something horrible about me. Like, so that could indicate that person has been through a trauma, and that's represented through that hole in the middle of the tree in the drawing. But if you ask them about this and they're like, you just say, oh, I'm curious about like the hole in the tree, tell me about that. Again, open-ended, just like you would in talk therapy. Then if they say, oh, that's where the happy little squirrel lives, and then they add the squirrel somewhere in the picture, like, then that's just sort of their schema for how you draw a tree. Like, and I didn't get into the whole graphic development of how our drawing skills develop, but at a certain age, there's it's the schematic stage, and you're developing like around 7 years old. Those kids have all their little people that are drawn exactly alike, lined up on the baseline of the paper. Like, that's their schema for how you draw a person. And then they develop more artistic skills and could do things a little more representationally and differentiate more. But a lot of us kind of draw at that level where we have our certain schema of like, this is how I draw a stick person, this is how I draw a tree, it has the hole in it, that's what you do, it has the little like swirls for the leaves. So you want to be curious about the artwork, and always just kind of go with what they say. That said, like I said, there are indicators, things that you can see, with the client's energy level, and I'll get more into this, but when I show our intervention examples, but you can tell if somebody is like, they come in and they look like they're holding it together, and then they draw and they're like tearing a hole in the paper with how hard they're pressing with the crayon. There's some anger there, there's some anxiety, there's some sort of emotion that has a lot of energy in their body. There's things like that you can observe, either just in the artwork itself or in their body language and their behavior. So observe those things. A lot of that is intuitive things that you'll know, and then be curious about that. That just gives you some information of where to question, but you never want to decide for sure what to be true based on the artwork. I've worked in schools a lot, and I can't tell you how many times I've had other school staff, like teachers, or even in agencies, other therapists come to me with a client or student's artwork, and they're like, oh, tell me what this means. And 100% of the time when they come to me and ask that, they already have an idea of what it means. They're like, oh, this like fifth grader drew, somebody with a knife, and everything's all black and dark, and they're depressed and they want to kill somebody. Like, they've already figured it out in their head, right? They're applying their own meaning to it based on their feelings about those colors, about those symbols, all of that. And so I'm always just like, hold on, like don't freak out. Like, yeah, this could give us some information about that, but like, is this kid obsessed with this crazy video game and he drew this character just like that? Or like, does this feel like a calming color to them and it feels like a dark, depressing color to you? You know, especially with colors, we're quick to assign meanings like black or red, that means angry, and blue means sad. But what if your favorite color is red? Then that's your happy color, you know? And so we want to allow space for our clients to express themselves in that way and be curious and ask questions without just assigning like our own meaning to it. Okay, so I know that was a long conversation on this, what looked like a short slide, but those are some really important key points here. Okay, so art as therapy. I'm going to give some examples of that. And again, it's just art done with someone who's not a licensed trained art therapist. So the art that you're doing with clients or art that you or your clients would do on your own at home. Okay, so I love this little picture of this baby hand with the paint on it. So examples of art as therapy. So drawing a self-portrait, that's something that can be very insightful, again, for your clients to, or you to do on your own at home, excuse me, or to do in a session. It's super challenging. It can be very challenging to draw something, especially trying to do it representationally, but there's so much insight to be had there. I love self-portraits. Family members creating a piece of art together. I love this. You know, oftentimes, you know, it's great to just leave it open-ended. Like if you're doing a family therapy session, even, you know, to just leave it open-ended, have some materials out and challenge them to problem solve and create something together. There's a lot you can observe about dynamics and everything in that process. Illustrated journaling. I love this, you know, drawing something just to illustrate what you've written, or even just writing something like a mantra, for example, really big, and decorating the letters. Just adding any sort of visual element to that journaling process can be really powerful. Then guided imagery or meditation followed by an illustration. So if you think about guided imagery meditations you've participated in or used with clients, they're very visual, right? They're prompting you to imagine, you know, yourself as a tree and your roots down deep in the earth and how that feels. And then your branches stretching up high into the sky and feeling the warmth of the sun, you know, on your branches. They're very visual. And so I really enjoy having clients go through that process and then illustrating so some image that really stood out to them from that. Adult coloring books, I tend to criticize these, but there is a place for them. You know, for some people, they can be really anxiety provoking, and for others can be really calming. And it can just be so satisfying to get that brand new pack of fine tip markers or really sharp colored pencils and fill in those tiny spaces. So I think that can be great if that resonates with your clients. Painting to relax. You know, a lot of people talk about like a hobby of painting. That's definitely art as therapy. It's therapeutic. And I'm going to talk about the qualities of the different media in a little bit. And for sure, a lot of people painting can be relaxing. It can also be anxiety provoking, which I'll talk about as well. It just depends on the person or depends on the day. Sensory exploration with art materials. This is like what you see with this little baby hand here, you know, and again, I'll talk more about the quality of the different materials, but it's therapeutic in and of itself to just explore that, to just finger paint, even with adults, right? All ages, we could do all of this, to explore how those materials feel in your hand. There's so many different sensory experiences to be had there. I'll share this later, but scented markers, Mr. Sketch brand scented markers, that adds another sensory element. If you've got, you know, clients that are, especially those who need or appreciate a lot of sensory input, you know, you want to steer away from it. Of those who would be overwhelmed by the smell tends to be overwhelming to me, but that's just another sensory experience to add. The smell, even just the, you know, the natural smell of crayons, right? Doesn't that take you back to childhood? I can remember the smell of my crayon bucket that I had in my closet when I was a kid. You know, the bad smells or the good smells, a different sensory component there. Okay, so art therapy. So I am going to provide you with some examples of art therapy interventions. And again, I think when you're describing what you're doing with this, you're doing art therapy techniques, or you could say art as therapy, but art therapy techniques maybe for these because, or for any of this, you know, but but with following these guidelines that I've shared today. Okay, so I do think that this is perfectly fine. I trust you all to do these interventions with the knowledge you have from today and with your training you already have. So these are art therapy interventions. I'm going to give two different categories. I'm going to talk about scribble feelings drawings, and then I'm going to talk about more symbolic representations. So the scribbling aspect of this is, if you want to talk theoretical theories, I would say much more the psychoanalytic, psychodynamic kind of bent to it, because this is just like spontaneous expression. Okay. And there are, I guess I'll go down the list of these, but then I'm going to stop my screen share for a moment and share my visuals with you so you can see those bigger, because I don't have photos of those here. So first, to explain what a scribble drawing is, and these are all different variations that use the scribbling. So when I say scribble drawing, what I really mean is doing a drawing, or I mean, it could be painting, more conducive to drawing materials for this, but using line, shape, and color only. So actually the image I have here on the screen is not technically a scribble drawing, because you see representational things. You see some clouds, the little symbols for birds, looks like a little cat there. And I see it's scribbled out. This is a photo from the internet. They scribbled out a drawing they didn't like there. So we're thinking not representational. It is literally just a drawing using line, shape, and color. And the way that I walk clients through this is I say, imagine that we start with a feeling. Okay, so this can be done just for the kinesthetic quality of it as well. If somebody's just got some energy, especially a kid, they need to get it out. But we want to, after that, if we can, we always want to transition it back to a conversation about feelings, right? We want to then go into having them identify a feeling either after the fact, after they've drawn, or before. So if you're identifying it beforehand, you're saying, so I've got this orange marker, and I'm like, okay, if this feeling that I'm having now, let's say I identified feeling anxious, or maybe just some energy that I can't name, if that anxious energy, that feeling was moving from my brain down through my arm, out through this marker onto the paper, how would it move across the page? So of course, with anxiety, it would have some energy, right? It might be like my example earlier of somebody just like tearing a hole in the paper because they're coloring so hard. Or a fear or anger would have that energy. Whereas we think about, if you're feeling sad, that's going to be likely a heavier, slower energy, right? And I find that clients of all kinds are really, really in tune with this and really intuitive and do well with it. I'm sure, for some, this would be challenging, and you need to walk them through it a little bit more. With kids, sometimes I've turned on music, and we can call it like arm dancing, doing it to the music. Again, just to get used to the feel of it, and then you start to add in and talk about the feelings. So we're going to talk about mad, sad, glad, scared, which is a very classic kind of basic intervention that is more of a CBT kind of approach. Scribble chase is great for like a joining, kind of building rapport activity that is a little more just abstracted, just kind of letting whatever comes out come out. Bridging emotions is adding in a CBT element. The life before, during, after, a little bit, add some structure to it, and then that soothing drawing is just supposed to be relaxing and kind of letting loose. So I'm going to stop my share so I can. Okay, so I'm going to share these with you. Okay. This. All right. So the mad, sad, glad, scared is my first one. This is, so this is kind of a large piece of paper. I suggest having both kind of regular 8.5 by 11 white copy paper, or white drawing paper, or construction paper, and also like a bigger size, like an 11 by 17 copy paper or drawing paper. Also, construction paper. I love getting white construction paper because it's thicker, kind of like a drawing paper, but you can often find packs at an art supply store of just one pack of white or one pack of blue or gray or whatever. And I really enjoy that, just being able to choose one color. So make sure you have white paper available to your clients. Construction paper is great as an option, but you want to always have white, not just like, oh, I've got some purple paper here, try this. Like, you always want to have white as a choice, because the colors that show up are important. And if you've ever used like marker on a colored construction paper, it just doesn't show up the same. So you want to have white as an option. So mad, sad, glad, scared, or happy. Glad rhymes, so that's kind of fun to say. But so you want to fold your paper, no matter what size it is, into 4 different sections, or this could be done on 4 different pieces of paper. It could even be done, I've done it on index cards before, so 4 different index cards. But I like to do it a little bit bigger. You can also do it with 4 different, more regular sized papers, okay? But this is one way to do it, where you just fold the paper into 4 sections and you label them each: mad, sad, happy, scared, or mad, sad, glad, scared. And you're doing that scribble drawing, essentially 1 for each emotion. So you're thinking about how your body feels with each emotion, and you're just expressing that through line, shape, and color on the page. This is actually one I did back in graduate school. It's a very old piece of paper. So this is sad. It just didn't have much variation. It was calmer. My mad had a lot of energy. It's like this burst. My scared was a little jumpy, right? And then my glad or happy was just kind of more contained, more whole and calm. And then, so you could leave it there and just kind of leave it as a way to be expressive, right? Or another option, to take it another step, is to have the client identify similarities and differences between the different emotions depicted. So oftentimes you will see a client who all 4 of the drawings look the same. Like even if there's different colors, the mark making, the lines, the scribbles look the same. Or so then you would say, like, the shapes and lines all look similar, but differences are, you use distinct different colors in each one. Some of them are just all the same, like it's the same types of colors, it's the same types of mark making. And you'll find that that really mirrors how the client experiences those different emotions, right? And so, someone who is just not able to differentiate much between their different feelings, so maybe sad looks a little different, but the other 3 are all the same. That gives you it gives you information as the clinician, but it also helps them to identify that, right? Because you might have noticed this, like they have a really flat affect, they're kind of the same all the time. But it's hard to just say that, like, I see that you just look the same, like, what are you feeling? I can't read you, or you can, a better alternative to saying that is to refer to the artwork. You can reference that and ask, notice, like if they don't bring it up in notice, you can say, hey, I noticed this, I observed this, I'm curious about this. And so you can notice out loud that there were similarities or there were big differences, and ask them more about that and point out those things and say, is this consistent with, does this seem to match for you, like how you experience these emotions, and talk them through that. So that's that verbal processing component of the session, like I said. Another option for where to take this that takes it more into that CBT realm of connecting this to your behaviors, like talking about coping skills, is on the back of each one, or I guess you could do it like on the front somewhere. You list, it'll be hard to see here, but there's a little list on the back of each one. You list, oh, well, I guess this isn't like, I was thinking coping skills. We'll get to that in a minute with another one, sorry. Forget that, but it's talking about body signals is what it is on this particular example. But I'm going to show you another intervention that goes into more coping skills after the scribbling. So, which that's more CBT. So this is, you write down, I have 3 numbered here. I guess that was the directions. Three body signals, or like ways that I know that I'm feeling that feeling. So for my angry, mad one up here, I wrote face turns red, I get sweaty, and I talk loudly or yell. Then for my sad, I put cry, I get quiet and withdrawn, and I move slowly, So have them list, 3 or more body signals or ways that they can tell that they're feeling that feeling. So this is a really great sort of introductory thing to just start a conversation about emotions and to learn about your client. So the scribble chase, this was an example that was already started. So this is where you and the client are going to do this together, or you can have 2 family members or 2, people in a group. I used to do this in group therapy a lot. I did it with adults with developmental disabilities. I've done it with children. I've done it with families, where I call it, I still call it scribble chase. I say it's like a drawing game, okay, where everybody takes turns. But how I initially learned this was it's between you and the client. It's a great joining activity, great for building rapport. So again, with that scribble line, you know, you have the client draw a scribble to show what they're feeling. And then you or whoever takes the next turn, or I guess you could start by demonstrating it. Then the next person picks up where they left off. And so the rule is you're keeping that marker or crayon or whatever on the page. You can't pick it up, but you can go as much as you want. You can overlap as much as you want. So this is going to, in the end, if I kept going with this, I'll just do one more example to show you. You know, you're going to scribble on top of each other. So by the end, this can look like a really like crazy complicated scribble with, as I said, crazy, there's a kid yelling outside. You know, it's going to be a lot of overlapping, a lot going on by the time you're done. And I like to sometimes have the person put a little dot kind of at the end of their line because it gets confusing after a while. So you can tell by the dot, like where they left off, and you just keep going. You can start this out again, which is the kinesthetic quality of it. Of just enjoying doing a scribble, kind of teach that scribbling process, and then work in the directions of adding an emotion to it. And yeah, I think the original scribble chase, it's just kind of the scribble, but I like to work in that emotion. So you're scribbling a certain emotion, and then sometimes it helps to have a list of emotion words, you know, or an emotions chart ahead of time, because it can be hard to just think of them on the spot. And then when you're done, an added piece of this, if you would like, is to sit and sort of color in like the little spaces that were created here, or some people might reflect on it and look and see something representational that seems to have emerged in the scribble. I don't tend to have that mindset, but a lot of people do. Like those of you who can look up at the clouds and think it looks like a bunny, you know, so you might see a bunny in there. And so then you can go back in and embellish that area to make it look like that representational thing that you see sticking out. So again, this is a great joining activity for you and the client, or can be great in a group or with family members. The next one is soothing drawing, which is similar, but so you're drawing the overlapping scribbles yourself. And I think if the client feels comfortable, a great way to do this is to have them close their eyes, and you can either hold down the paper for them so it doesn't move on them, or you can tape it down on the corners and have them choose kind of a dark color, like a black or a dark blue or purple, so you can see it, and close their eyes and just do overlapping big circles. You could even practice this in the air, you know, beforehand, practice those movements, and then have them do that. And you're kind of watching, and you kind of can just tell them when to stop, because you could do it much more than this when the page is full, or just have them stop when they feel comfortable. And then it's like you've created your own coloring book page, your own adult or kids coloring book, and you can go back in, similar to how I was saying with the scribble chase, and you've created all these different little sections. I'll color it in real quick. These different sections between your lines, and you can color that in. And this is just a soothing, relaxing thing to do. This is definitely something I've used to help de-escalate children. Again, working in a school setting. You know, there were often children that would come to me, they were upset. Those of you who are school counselors, I know, experienced that. And so not when they're like super escalated, right? But like if they're just still kind of and they don't want to talk, this is something you can have them do if you know they're like not ready to go back to normal life yet. Also, this is something you can just do for fun. Whether the client feels like they need to be especially soothed or not, this is something you can do. You can introduce it as a coping skill. Like to adults, I've introduced this as something like, hey, we're going to do this in the session, just kind of while we talk, you know, talk while you do it. But this is something you can try at home on your own. Okay. So that's the soothing drawing. Oh, I skipped the bridging emotions. Okay. I'm going to go back to that. So this is, like I said, this is like a very cognitive look at this. Everything is like charted and mapped out and structured, and we've got coping skills here. Okay. So this, you're going to fold your paper into these three tall sections. You can do this on a regular piece of 8.5 by 11 paper, but it works well on this longer paper, obviously, the way this is portioned out. So on the left-hand side, you're going to label it with a feeling like an uncomfortable or negative feeling you have now that you don't want to feel. And on the other side is how you do want to feel, like the opposite of it for you. So on this one, I put scared and relieved. And then you're going to have them do a scribble drawing to illustrate each emotion. So that's what you do first. And this middle part is blank. And then you go back and at the top, you label what I do for myself. And then this bottom part, what others do for me. So under what I do for myself, you're going to have them list like 3 to 5 things they can do for themselves to get them from scared to relieved. So this is called bridging emotions, and we're going to add the bridge in at the end. Okay. So we want to move along this, or you can add it in at this point. So a line, or it could be look like a real bridge, but at least a line connecting the two. And then at the end, you're going to have them identify where they are on that bridge. So on this one, I was kind of in the middle, like I wasn't all the way in the scared, I wasn't all the way in the relieved yet. I was like on my way in the middle. So have them identify specific things they can do for themselves, and then specific people and what those people can do specifically to help them move from scared to relieved, or sad to mad, or what, or no, sad to happy, mad to joyful, whatever it is. And so let's see. So some examples, like I wrote down on here: write down my feelings, pray, continue to do things I enjoy, like walk or ride my bike. So kind of the coping skills, the behaviors we want to pull in here. And then what others do for me, or sometimes I word this, what others can do for me. Of course, it does involve an element of the client has to do something, because they have to contact this person and make their needs known, right? And so there is an element of that. It's not just we're going to expect these people to just know this and magically do this for me, because we know with some clients, they're going to kind of expect that other people are just meeting their needs and they're not communicating their needs. So that's an important thing to make clear. You've got to ask this of this person. We want to make it specific. Like I put, my sister talks to me and we encourage each other. So those are things that are already happening. You know, I named a specific friend and what they do for me. Okay. So it can be things that you're identifying that are already happening, that are good, and just being aware of those supports. Or it can be like, this is something that they can do for me that I want to ask for. Okay. To help me move from the uncomfortable feeling to how I want to feel. So that's a really great one. Harder to do with kids. It's better for teens and adults, but it's a really great intervention. And then the last of these scribble drawings is symbolic representations. So, or no, sorry, I was moving on to symbolic. The last of the scribble drawings, this one is life before, during, and after. Again, this is just a sampling of interventions I think are really good and effective, and that I think you all could easily implement. So the paper was folded into 3 sections. You don't have to fold it, but you know, it helps to get them equal. And I drew a line down to further separate it, and labeled one section life before, whatever stressor, life during, and life after. So in this, it was cancer treatment. I did this during grad school. My mother was dying of cancer at the time, and she had just started cancer treatment when I was starting graduate school. So that was a big stress on me, you know, in my 20s, dealing with that. And so again, when I was in class learning this, I really did it with a real current stressor in my life. So I want you to do this for yourself, just like all these interventions, before you do it with a client, so you know what it's like to process through something real in your life using these interventions. So life before cancer treatment, I did. This doesn't have to be abstract and scribbling, but I think that can be helpful. You could, I kind of naturally go towards that. So I did kind of this free flowing, nice thing. And then this is more rigid and like, you know, I just didn't like it during. And then after, I was imagining there'd still be some of the difficult, but like some good stuff too. And so, so with this, you could choose to direct it as a scribble drawing, like I explained, through line, shape, and color. Just draw kind of what feelings are associated with this. Or you could leave it more open-ended, where they could draw something representational. So this doesn't have to strictly be a scribble drawing, but I'm just presenting it kind of under that category. But a lot of people are going to want to go more representational with this, and that can give you a lot of information. I'll say I've done this in a group format as well, with a family, where we had big butcher paper taped on the wall. You could even do this with like a whiteboard if you didn't mind, or chalkboard. I'm thinking of people in a school setting, but or you could have 3 different big pieces of paper up on the wall, one for life before, one during, and one after, and have everybody work on it together through drawing. Or I've used magazine clippings, like had a lot of magazine pictures clipped out ahead of time, and then they could just go tape them up under the different category. So that was interesting to do as a group as well. Okay. we're going to move on to the symbolic representations. I'll show you that slide here. Hold on. Okay. So we talked about the scribble drawings. Whoops. Okay. So these are symbolic representations. So I'm going to talk about the trauma tree, which I mentioned earlier as like with the hole in it. This is something different. A life roadmap, a family crest, some sort of 3D self symbol, and also a mandala, which can look a lot of different ways. Okay. And I've included in this training, you have a copy of the slides too, if you want to go back and reference this, or you have your handout. Okay. So I'm going to go back to stop share here. So the trauma tree, that's just the name of this. It doesn't necessarily, it doesn't have to have a hole in it. This is where, and so these are symbolic, these are much more cognitive symbolic things, okay? As opposed to just the emotional expression end of the art therapy. So this is, you have the client draw a tree with branches. It doesn't have to be complicated. It can be like this. I drew this for the purpose of this training, the first time I did the training. And for each branch, or for some of the branches, have them identify something that was traumatic, stressful, like something that they'd identify as like bad in their life. And then for the growth, off of that same branch, either it could be either a leaf or a flower, some type of growth. They're going to write something good that came out of that. So for this, I put my mother died, and then I put as growth that brought me closer to God, closer to other family members. I inherited some money, which enabled me to buy a house years later. So those are good things that came out of that traumatic thing. So you know, you need to gauge where your client is with processing their trauma or their grief with this. This may not be helpful depending on what stage they're in, but this is a really great symbolic representation. You can sit there and literally like see the growth. Okay. The other one, the life roadmap. Again, I tend to think of things more abstractly. So this is very abstract. You might not be able to tell it's a road, but essentially you're thinking of the road as a symbol for life, right? So if you think of like, this could be like a map, you could word it as a map or a road, and thinking about obstacles along the way as symbolic of the obstacles that they're facing in their life, right? And so I did this abstractly. So this is my curving road, and the black things are the obstacles, which I knew like in my mind at the time, like what those were. Or certainly if I had processed it with therapists, I would have been able to talk about what those obstacles were when I drew them. But you could have a client if they're doing this representationally, they could be labeling, they could have caution signs and road work ahead and all that kind of thing. I actually did this once with a group of adults who had been sentenced to group therapy for getting a DUI. So they were having to deal with substance abuse. And I had them do this life road drawing, passing around markers, this group of like 20 disgruntled people that had to take the TARC to that counseling session. But some of them, you know, they really got a lot out of this. So identifying like, what are those roadblocks? What are those things keeping you in the way of achieving what you want? And where are the good things, right? Where's the growth, the trees on the side of the road, the sunshine, the friends helping you out, the bridge that got you over the difficult obstacle. You know, there's just, you know, use your imagination. Your clients can use their imagination as far as whatever symbols represent what's going on their road of life or their map of their life. Okay. And family crest. This is a great kind of get to know you thing. You might have seen a lot of worksheets like this. This is one that another therapist made. That's why it's like cursive writing. This is a handout. I don't have an example of one that I've colored in right now, but this says just for today is how this is worded. And in the middle, it's a symbol for me. It could be a picture of themselves or just a symbol. And the different sections you fill in with a fun memory, a caring person, a deep thought, a difficult challenge. So you could think of whatever categories you want for this and kind of make an example for them like this. And the idea is like you would have like a family crest that is symbolic of the family, which you could do that in family therapy as well. This is like a personal crest, a personal self symbol, a personal shield of this represents me. So if you're getting to know a client, I've seen worksheets like this where it's just like my favorite food, my, you know, things for kids that you could fill in these sections. I really like this, that it's, you know, a fun memory, a caring person, a deep thought, a difficult challenge, and then a symbol for yourself in the middle. So you could, I mean, you could structure this however you want, depending on the client. You could change it up for different sessions with the same client, just different information, you know, to encourage them to share all together in this symbol that represents them. Oh, there's my example on the back. There's one that I drew. I don't know what these prompts were, but yeah, where I had filled in a shield myself. And then mandalas. So when I say mandala, I mean just a circle design. And so that can be freehand. It can be filling in coloring book pages. This is a real simple coloring mandala page that I use with clients a lot. And so what I recommend with this is making sort of a key. I don't know if you can see that on here. Kind of make a key somewhere on the margin or on a separate scrap piece of paper where you identify what color goes with what feeling. And that's a great way to do this. So like I had this brown color meant tired, the blue meant turquoise blue meant happy, the orange meant energetic, and this green meant content. And so so you kind of identify those, assign those colors and meanings together without, you're not judging them. It's whatever color they want to go with what feeling, right? They get to choose, and then just have them fill it in. And sometimes I give more directions ahead of time, and sometimes I just kind of mention it after. You can tell them ahead of time if you'd like. Think about how much of you is like, how much of each of these feelings are you feeling today? So if you're mostly the happy content, you'd have more of that turquoise blue, if that's your color. If you're mostly tired, you'd have more of that brown tired feeling. Okay. Sometimes it's kind of too much for them to hold that in their minds at the beginning. And so we just assess after. You let it be a spontaneous, intuitive thing. And you just kind of talk through like, I see you had a lot of the brown. Do you think that you feel more of that today? Or is that not consistent with how you feel? You know, sometimes it's better to let that come out subconsciously and then talk about it at the end and see if it's consistent with how they feel. Similar to how you would talk about the different scribble feelings in the mad, sad, glad, scared. Like, what do you think about this? These look similar or different. Like, what are your thoughts? Does that really reflect your experience of these feelings today? Also, I just love doing mandalas, just having them fill in a blank circle, just having that as a safe container for their feelings. You know, sometimes it's too much to just have the big open paper. So, I mean, sometimes even I'll just you could draw a boundary within the paper that's like a rectangle, the same shape as the paper, but just some other boundary. But I really like a circle. It just feels like a safe, soothing container to hold our feelings. This is just one more example of, this is a whole self mandala. This is just a quick little drawing I had done for something else as an example, I guess for a client, or maybe I did it alongside a client. So a whole self mandala is kind of like the personal shield, but it's just different things that make up you. So, so at the time, I don't know when I did this. So I said student, daughter, sister, granddaughter, friend, artist. And then the question I have on here is, how has each role been affected? Okay, this was for grief. How has each role been affected by the loss? So if you've experienced a loss, you can talk about, or any kind of stressor, like how has each role that you play, how has that been affected by what you've been through? So that's a way you can take this with the whole self mandala, or it can be sort of a pie chart if you'd like as well. Like you can allow them to split up the sections however they want, but just different aspects of themselves. And then, yeah, a way to process that is, how have these different roles that you play, these different aspects of you been affected by whatever your stressor is, whatever you're going through. Okay. I'm going to go back to my share here. Go back to our presentation. Okay. So here we go. So again, there's that list for you if you need to reference that later. You can look up the slideshow. I'm going to talk about art and media, and I know we need to finish up here soon. This is another thing that's really important, kind of like my do's and don'ts from earlier. This is really, really foundational to the practice of art therapy. Okay, so with art media, and this is something you can email me to ask questions if you have them, because I'm going to go over this real briefly, but you want to provide a decent range of basic drawing materials at least, and then with more with painting materials, depending on kind of your office situation. I think watercolor paints, and I'll show these without on the share screen later, but just the basic Crayola watercolor trays are great. I always say you can get them even in the school supply aisle of your grocery store. Like it's easy to obtain and it's easy clean up. But you can also certainly use like tubes of acrylic paint, other forms of paint. But I mean, I use drawing and painting mostly for therapy. We'll talk a little bit about 3D. There's some different options. You know, you can use any kind of art for art therapy, but you know, what's most conducive to an office setting is what I gravitate more towards in this training in particular. So any art media we use, we could classify it on the spectrum from resistive to fluid media. So obviously, fluid refers to water. So one of the most fluid medias you could use is a really watered down paint or watercolor paint. So then more resistive would be like a pencil, right? That's on the other end of the spectrum, and everything in between. So if you think about an oil pastel, if you use those, or a soft chalk pastel, those glide on the paper a little easier than a hard pencil. And so they're a little more towards the fluid, right? But not as fluid as paint. And so any art material we use, whether 2D or 3D, can be put on this spectrum. And the reason this is important is that the more fluid media is more emotive. So I'll say that again, because this is important. This is the reason why we care about this spectrum of resistive to fluid. So the more fluid media is more emotive. It's going to bring out more emotions. That sensory experience is going to affect the brain in a different way than with more resistive media, which it feels more controlling, which can feel very safe, you know, or it can feel infuriating. Either way, it depends on your client, depends on their emotional state at the time they're doing the art, depends on your emotional state when you're doing it. And so examples with 3D media would be if so let's say, fluid would be like a water-based clay. Like if you imagine someone using a potter's wheel and adding water to it and, you know, just spinning it on the wheel and shaping it, that is very fluid, right? So that's going to be a more emotive experience than hammering two pieces of wood together with a nail, right? Or you think of like cutting paper and using collage, you know, gluing it together. Which even that, it could be more fluid if you're painting on liquid Mod Podge glue versus using a resistive glue stick, right? So I want you to think about that as you're implementing the art materials. Let's see, I'll go ahead and I'll just share for just a moment kind of some different examples, just in case you're really unfamiliar with kind of these basic materials. So the watercolor tray, you can order, you know, all different levels of this. This is the very basic kind of kid level that could be used, you know, with all ages that you can find so many places. I mentioned you could use tubes of acrylic paint. So typically acrylic paint is going to be thicker. And these tubes, kind of like toothpaste tubes, are going to be thicker than like a craft paint that's in more of like those little bottles, you know, that's going to be a little thinner than this. So if you really want to have a wide variety, you can have a variety of all those different types and thicknesses of paint. Or you can just know, hey, I have one fluid option. It's the watercolor tray, right? Got markers here, got Sharpies. They're a little bit fluid, right? But if you've got like a fine tip, that can be easily controlled. That's a good kind of fluid option for doing coloring book things and coloring in little. It's a little fluid, but then you can still control it because of the size of it. I really love crayons. I think they're a great in between. They're real kind of in between on the spectrum in the middle. And I love these jumbo crayons. This is like, as far as I know, the biggest crayon other than those egg-shaped Crayola crayons. Definitely only use Crayola for crayons. They're the best. Rosart is not, you're not going to get a vivid color or a very thick crayon. These things are huge, and I like to peel the paper off of most of them. And you can use, I've got some broken pieces here. You can color with the side of it. And for someone who has a lot of energy for when you're doing those scribble drawing interventions, I love to have this out as an option because it's hard to break. I mean, some of these are broken, but you can press real hard and use a lot of energy and it doesn't break. So I really love that. An oil pastel, if you're not familiar with that, they're sometimes called like oil crayons. And so you can get all different like sizes and widths, but they're going to glide on easier and they're blendable. In some ways, it's like a kind of like a thick paint stick. Really nice ones you could even like thin with like paint thinner. I don't get into all that, but kind of like oil paint. These are water, you know, you wash them off with water. It's not like you need paint thinner for these, but this brand, Craypaws brand, I think is a good one. It's Junior Artist. These are kind of like kids student grade, you know, easy to find. Pentel is another brand that makes oil pastels. I like the Craypaws or the Mungyo brand. Okay. Also earlier I mentioned the scented markers. One last thing, as far as a fluid drawing material, is soft chalk pastels. So they tend to come in these square pastels. You can get them in different shapes. They can be circle cylinders, but often they come like this in a tray where they need to stay so they don't break. They're very powdery. And so when you, even more so than like a sidewalk chalk, these have a really fine powder because they're soft. And there's different levels of chalk that are not as soft, but I love these soft chalk pastels because you can, when you color, it creates the dust and you can either shake that off or blow it. Well, don't blow it off. You can kind of shake it off in the trash can. Or I always tell my clients, you can use that color. You can use that dust to spread the color around the page. So if I colored with a bright yellow and I have this whole pile of yellow dust, if I want that yellow to be bigger, I can just move that around the page with my hand or with a paper towel. And so it does get messy, but it's easy cleanup. Like it just washes right off of clothes and off your hands. So that can be used in an office setting. Be careful with the dust though, of course. You don't want to be breathing in a lot of that, but again, it's not toxic, you know, and it cleans up easy. So you want to be mindful when you're working with clients of what, first of all, I'd say give them a choice of some of the basics. Now, when we provide like a huge choice of materials, that can be overwhelming. So maybe a few choices of drawing materials, have them experiment with each one if they're not familiar with it, so they can sort of intuitively choose what feels good to them based on how they're feeling that day. But you know, it's interesting. For example, someone who is feeling anxious, of course, that's related to a need for control, right? So we gravitate towards art media that we can control more. So you're going to have those clients who are going to want those colored pencils. They like their adult coloring books. They want everything to be controlled and neat and tidy. You know, people who draw really little in the corner of the page and they're like erasing a lot and they want it to be perfect. That's someone who's probably more anxious and needing more control versus someone who's a little more open with their emotions and they want to be more expressive, or they just feel the need to be expressive. They're going to maybe gravitate towards or just be more comfortable with the more fluid media like an oil pastel or the chalk. Now, what you as the therapist can do here is you can sort of inch them towards one end of the spectrum or the other based on what you feel like their needs are. So for example, if someone is really controlling, like there's nothing wrong with using those pencils. Like that can be a safe zone and provide that feeling of control in that art therapy session, whereas they don't have that in other areas of their life, right? So it can be really soothing and helpful in that way, literally just to draw a free drawing, whatever they want, using that material that helps them feel some control. So that is therapeutic in and of itself. But if we're working on sort of, you know, if your goal with the client is to work on loosening some of that control and sort of trusting the process in many areas of their life, then a safe way to do that within the therapeutic process, within that therapeutic relationship, is to inch them towards a little more fluid media. Have them experiment with oil pastels and see how it feels on their hands, and it gets their hands dirty, but they can go wash their hands. You know, with kids, I always used to say, the good news is you're washable, like when they would complain about feeling, you know, dirty or messy from the materials. So have them experiment and see what that feels like. And you know, just like with anything, you don't want to push them too far. You know, it may feel a little too much like exposure therapy where it's like, oh, they're freaking out. Like, you know, like gauge what you feel like would be appropriate based on their needs, but know that you can use strategically this spectrum of the resistive to fluid to help, you know, kind of ease them one way or the other, you know. And so on the other end of the spectrum, the other extreme is someone who is very emotional, like they're having trouble reining in the emotions and getting kind of you know, getting grounded, they're just kind of hysterical, they're in their emotions a lot, then you can help them have that sense of healthy control over their emotions through using more easily controlled media, you know. And again, you just want to kind of gauge where they are and be careful with this process. But I think if you are yourself familiar with those basic materials you're providing in your office, and you know, with this knowledge that I'm sharing with you today, I think you can competently, you know, kind of experiment with this with your clients. um, and I want to caution you though, with the fluid media, I'm going to give this kind of funny photo. So it's so interesting to me from an art therapist perspective. I mean, you know, as a mental health professional, like we see things through our lens of our training always, right? Like in movies, commercials, out at a restaurant, whatever, like we're analyzing things based on what we know about human behavior. And so when I search, when I'm creating slideshows like this, when I search for images of women painting or just paint, like things like this always come up, and it makes me laugh because what I see when I look at this is someone who is too much in their emotions, right? They were finger painting. They're too emotional and they've really like regressed and they're painting on their face. And this woman looks kind of crazy. And I'm like, what other than this slideshow would anyone use this image for? I mean, she looks like she's not like stable, right? So it's interesting to me that I find these, but I was showing this not just to share that funny thing, but to give an example of it was back when I was in graduate school. I was doing a group art therapy with a group of teenage girls, and we were painting piñatas. So this wasn't like they were painting a picture to make it look like a certain thing. It was very just big brushes, expressive paint on the surface of these big balloon-sized piñatas. And so they really got in their emotions. They got really giggly and started regressing and painting on their faces. Not quite as bad as this lady, but you know, that's something else that comes out with the emotion. So you're getting more into your feelings, but it's your subconscious, like you're accessing more of your junk, more of your trauma. It's coming up through the use of these fluid media. So be aware of that too. I mean, you may experience clients regressing. So you want to make sure, so don't be afraid of that. You know, you want to make sure that you're using all your tools in your therapist toolbox to help get them grounded after that. So it's okay to let, again, of course, your office, your session with them is that safe space to let that out, to access those things, but you want to help them get grounded again before they leave you. So one great way to do that is just through the cleanup process, through wiping down the table, cleaning their brushes, washing their hands, you know, way to get them grounded back in their body. But any other kind of technique that you use to help clients get grounded, you might want to implement that after painting, or even and maybe any kind of artwork, but especially the more fluid, using the chalk pastels, the paint, even the oil pastels. Okay, so that's something important to keep in mind. This last part, this is not on the handout that's included, I don't think. But this is an important question ethically of what to do with the artwork. So I'll go over this briefly. You know, according to the art therapy ethics, the artwork that a client creates is a document that belongs in their client record, you know, and that should be protected behind two locks, all the HIPAA rules. I know those of you working in schools, you follow the FERPA, right? But whatever it is, like this, whatever your specific, you know, confidentiality guidelines you're supposed to follow, the artwork is considered a document, just like all those other documents. So this is a difficult ethical issue because you can accumulate a lot of artwork. If working with kids, especially, you can have like a two purple scribbles on a paper that a kid left in your office when they came to calm down, and their name's not on it. It's like, do I try to save this in someone's file? You know, like, so So I will say first, these suggestions I have here of what to do with the artwork, these are all appropriate ways to handle it. Now, have I always handled my clients' artwork that way? No, I haven't. Okay. And so this is one of those, like the battle of the wits conversation that Bruce Moon was having with himself in his ethics book, and that we often have with ourselves with ethical dilemmas. You know, we can drive ourselves crazy trying to think about all the details, or we can just assess the situation and kind of do the best we can. Okay. So one option is to keep the physical artwork in the client's chart along with other physical paper documentation, if it's small enough to do that. You can store it in some other secure location, in your filing cabinet, in your locked office. You might have a shelf or a drawer that's just for client artwork, or you might have separate folders for that. You can take photos of the art and include the digital copy of the art in their client's electronic medical records, right? So that's great. And then you would shred or destroy the original artwork. Or you can send the art home with the client, whether you take a photo of it or not, you can send it home. That's my favorite one. I'm like, this is yours, please take it. This belongs to you, but sometimes they don't want to. Also, in between sessions, whether it's a longer term project, they're working on multiple sessions, or if it's just your kind of to see their progression of what they're working on, it can be really helpful to keep it in your office. I almost said in your art studio, in your office, in between sessions, because it's great to look back and see the progress. If you're someone who keeps a journal, for example, it's so great to look back over the past weeks, months, years, and see what you've journaled about. And so in a similar way, through the therapy process, this artwork is this visual representation of their emotional progression, of the challenges they've had, and that's such a beautiful thing about art therapy. And so it can be great to keep it there in your office during the duration of your treatment or for a certain amount of time, so you can pull it out periodically, or maybe even every session, and review the progression there. It's so great to see that visual right there. This is a side note that I meant to mention earlier, is that often in art therapy, we refer to the piece of artwork as like the third person in the room, and it's easier to, especially for teenagers, those who are kind of resistant to therapy, it's easier to talk about the art, this isn't me who's angry, it's this tornado in the artwork. We can talk in that symbolic. I think I meant to bring this up when I was talking about the symbolic interventions, but it can feel safer to stay in those symbols and those metaphors, right? I worked with a client years ago, a teenager who drew a tornado, and let's say it was Eric. It was the Eric tornado, right? And he felt comfortable staying in that metaphor of the Eric tornado, and what happens when Eric the tornado does this and the tornado does that, and he destroys his family. And we stayed in that metaphor, and that was a really safe way for him to process some real worries and fears that he had about his own behaviors and how that was affecting those around him. So yes, that said, having that as a document that you bring out in the sessions can be helpful. But I do like to send it home with them at some point. You can display artwork in your office only with the client's consent. I'm careful about this because similar to the reason earlier, if you want to be careful if you're creating art alongside the client, that they might be more focused on your art than their own. You don't want a client coming in and feeling intimidated by seeing other people's artwork, or to be more focused on that, for that to give them a reason to be distracted and want to talk about your other clients versus themselves, but especially if you work with kids, often they want you to hang it up. And so that's where I have done that. Like when I worked in the schools, I did sometimes hang up artwork, or, certainly if a child gave me a drawing that they did, like whether it was in the session or they did it otherwise, I would put it up kind of over by my desk in my little corner, separate from where I sat with the clients. So use your judgment there. And certainly you don't want to hang up anything without their consent, right? Because it's a private document that others should not see. Okay. So that is it. My last notes about documentation, or storing it as documentation. If you have any questions, please feel free to email me, to reach out. If you are viewing this on my mobile app, the Redefined app, Redefined by Jennifer Kramer is the name of the app, then you can see my other resources, things I offer there, some for free, some for purchase. So feel free to engage there or refer clients to that. I think there's a lot of beneficial information there in my video bundles for those who are your clients recovering from narcissistic abuse or anything else, or yourself, even if you want to learn more about art therapy and the process that I teach with my clients. And so you can, so you're probably viewing this in the app now, so you can check out those other things or go to my Linktree website to see what else I do. But again, you can contact me through email if you have any questions specifically about this training. I would love to be able to share more trainings like this. If there's any particular thing that I touched on as a part of the training today that you would like to hear more about, I'd love to get feedback about that. So thank you all so much, and have a great day. Go use your art therapy techniques.